You may hear from a friend or colleague that if you identify or notice floaters and flashing lights, it's very important to see your eye care provider to get it examined. And why? Well, what happens, the eye, as many people know, it's similar to a camera. We have a lens in the front and the film in the back. Somewhere in between, there's a jello-like substance, which we call the vitreous, which serves a purpose when we're a baby to keep the shape of the eye and to help the eye to grow. Unfortunately, as we get less young, seasoned, more birthdays, however you want to say it, that jello-like substance within the eye will start to degenerate or shrink. When that vitreous degenerates, it breaks down and you can identify or start to see floaters. And most commonly when we see that is what we call a posterior vitreous detachment. Again, when that vitreous starts to liquefy, it separates from the film or the back of the eye, which we call the retina. A PVD or vitreous detachment many times is not a concern, and the floaters over time may actually disappear and you may not notice them very often. Commonly, you may notice floaters more in a bright room or if you look on a white background, but again, over time, floaters can settle to the bottom of the eye and not be apparent to you on a day-to-day basis. If you do develop a vitreous detachment, it is imperative for you to get assessed, and one of the reasons for that is the vitreous, when it's separating from the film or the retina, in some individuals tend to be a little stickier, and when it starts to detach, can pull or tug on the film or retina and lead to what we call a retinal tear. If a retinal tear occurs, which can occur 10 to 15% of the times when you have a vitreous detachment, that is very important for us to identify, as we have the capability to treat it before it leads to something that we call a retinal detachment, which is more damaging to the vision. Should there be a tear, rest assured we have the capability to treat that many times in the office with laser, which acts like spot welding or gluing around the tear that's in the back of the eye to prevent further or more permanent loss of vision. Unfortunately, sometimes individuals ignore floaters, and if floaters continue to persist, or you start to appreciate flashing lights, which is when that vitreous or gel is tugging or pulling on the retina, we do ask that you give us a call should you start identifying more floaters or flashing lights, because that could be a sign that you're developing a retinal tear as this vitreous is degenerating. Ideally, we want to catch a retinal tear early so that we can provide treatment within the office with laser, which acts as glue or welding to spot weld or surround the break to ensure the break does not get larger, or the retina, which is the film or wallpaper in the eye, does not start to detach. Should there be a detachment, or should the retina not stay on, or we not catch the tear early enough, that is what we call a retinal detachment, which should you start noticing a curtain or shadow, that many times will require further treatment in the form of either surgery, which we may provide an in-office procedure, or you will be needed to be taken to the operating room. The in-office procedure is something that we call a pneumatic retinopexy, and we gauge that based on the descriptions or findings that we see on examination if you'd be a great candidate for that. Other options would be taking you to the operating room, where we put you under anesthesia, make you comfortable. We place trocars or small incisions on the white part of the eye. We go into the eye, remove that vitreous or gel that was causing the tugging or tear in the retina. We place the wallpaper or retina back up. Again, we apply laser around the tear. Sometimes we may freeze the tear with something called cryopexy. And after that point, we have to place something in the eye to hold it. The analogy I like to give to patients, imagine if you break a glass or figurine, you put it back together, and after you glue it, you have to hold it for the glue to set. The way how we do that is we place a gas bubble or sometimes an silicone oil bubble that will stay in the eye to hold the tear in place until the glue sets. Many times you'll have frequent follow-up after surgery to ensure recovery, and if we can catch it early enough, we can have significant recovery of your vision. Should you have any questions or concerns, please feel free to reach out to any of your Georgia retina doctors who will be happy to answer any questions.